Opioid. What are the opioids? These drugs
helping analgesic system.
helping analgesic system. What is the function of analgesic system? Analgesic system function. Suppress
To suppress pain.
suppress pain. Okay. So if analgesic system fail to suppress, then we need to use opioid. Okay. Understand? So this opioid, they can stimulate analgesic system. So what are the receptor used by analgesic system? Mu,
Mu, kappa,
kappa, and delta.
Delta.
Which receptor most commonly we use?
mu.
Mu receptor. Okay. Understand?
Yes, sir.
Okay. Now to the first, before going to opioid list, we must know how about the side effect of these drugs. Okay, how they working in our body. So this mu receptor mostly present, okay, mostly present in our CNS. This mu receptor also present in hypothalamus. Okay. This mu receptor present in hypothalamus. This mu receptor present in thalamus. This mu receptor present inside midbrain. Mu receptor present in especially brainstem area, medulla. This mu receptor present inside spinal cord. So these are the different area inside the CNS where the mu receptors are present. Okay, so these opioids are working. The outside the CNS, but the location where the opioids are working, the outside the CNS. The other receptor, these receptor present on mast cell, receptor present on mast cells, receptor present on smooth muscle cells, also working on smooth muscle. Smooth muscle, if you remember, there are two groups, one longitudinal. Okay, if you want to understand the side effect very easily, you have to memorize this location. You can easily can get. Okay, no need to like just memorize as it is. So it's a very hard thing to memorize. Okay, as you very well know about antipsychotic, how they produce the side effects. You know, antipsychotic, strong, high potency, low potency. The important side effect was extrapyramidal side effect. Yeah, they are also working like anti-muscarinic. They also act on alpha receptor, also act on muscarinic receptor. Yeah. So these drugs also have very much variety of the side effect of opioids. Okay, opioids they also have too many side effects. That's why it's not just used for common simple pain. Okay, if pain is not controllable with by using NSAID, by using for neuropathic pain. For neuropathic pain, which drug you prefer for neuropathic pain? Till now we learn about neuropathic pain, SSR, SNRI, and TCA. Okay. Later, another drug group we also learn for neuropathic pain, anti-epileptic drug or carbamazepine we also use for neuropathic pain. Okay, these receptors present on mast cell. These receptors are also present on smooth muscle, longitudinal smooth muscle, circular. Okay, so longitudinal smooth muscle relax and circular smooth muscle contract. So this mean opioid they're doing what? They close the sphincter. Close sphincter. Okay. So smooth muscle areas is a smooth muscle of the GIT is a causing what? If they close the anal sphincter, close ileocecal valve, close gastroesophageal sphincter, close pyloric sphincter. So what happens? It leads to constipation. Okay, because they close the sphincter. Understand? They close the sphincter. Another thing they causing, they close the sphincter in case of urinary bladder, relax the wall of the bladder muscle, it lead to urinary retention. Urinary retention, understand? Urinary, urinary retention. Clear, clear? So these receptors, now we focus here, what happen if they present inside the hypothalamus. Hypothalamus is a part of pain suppressing system? No, hypothalamus is just a play role in limbic system. Important thing here, limbic system, yeah? So in the limbic system here, the producing here euphoria. The limbic system effect here is a patient behavior. What is euphoria? Every time happy without any sadness, yeah? Every time excited. This person is excited. It's a bit different from mania. A little difference from mania, okay? Close to mania. It's also a very excitable person, like the person just if they're taking morphine, heroin, just saying I am the president of country, yeah, like this, because addicted of opioid. It's a euphoria. Euphoria mean every time this person feeling what? Happy, no sadness. Understand? Very excited. It's a limbic system producing side effect euphoria. Most common side. This is the real side effect. For example, if you feeling better by using one drug, opioid, you become addicted to for using. You become addicted easily. So, what is the most common side effect of opioid by which the person become addicted? You must explain euphoria. The euphoria is a side effect. This is the biggest reason why these drug are drug of abuse. Okay, this is the biggest reason. For example, you have any type of stress, any type of tension, any type of an anxiety. If you're taking opioid, you're feeling it's just euphoria. Simple wording, like person feeling well-being, everything is right, everything, just person happy, yeah, it's a euphoria. In the thalamus, again same thing, anterior nucleus, okay. In the thalamus, in thalamus we also having, like if you remember, vpl and vpm, vpl and vpm action inside the thalamus also suppress the pain, okay, suppress pain. Oh, this is benefit, this is a benefit. Euphoria here just a main side effect here. In midbrain analgesic system start from midbrain. If this drug work in midbrain, then pain suppress, yeah, one thing. If another thing, if you remember, Edinger Westphal nucleus belongs to nerve number 3, oculomotor nerve, okay. How many nerves are parasympathetic? 3, 9, 7, 10, yeah, nerve number 3. So in the midbrain, nerve number 3 is excited. So parasympathetic system excited. Yeah. So which nucleus of parasympathetic system? Edinger Westphal, Edinger Westphal nucleus in midbrain, present in midbrain. Okay. So if this third nerve is stimulated, what happens with the eye? You know about cholinergic system, understand? So in the due to midbrain stimulation of nerve number 3, it causing meiosis. The meiosis is what happened with the people, pinpoint, just like a pinpoint, understand? People is totally constricted. If any drug abuser come to your clinic, come to hospital, and if you want to know, you don't know about this, if this person taking cocaine, taking codeine, taking heroin, taking barbiturate, taking benzodiazepine, like this, yeah, you don't know. So how you know about this patient having abusing a heroin or morphine? Focus on the pupil size. Pupil size tell you something, okay, it's a clue. Pinpoint pupil is the key thing, it's a drug abuser of morphine or heroin, understand? Pinpoint pupil. Okay, now come to medulla. What happened in medulla? The mu receptor doing what in medulla? Doing what in medulla? In medulla, one thing, they induce vomiting.
Uh,
induce in medulla doing what? Number one thing, vomiting. These drugs they induce vomiting. Okay. So at any time you're using opioid to control pain system, you must give antiemetic with this drug because this drug they can induce vomiting very strongly. Okay, they induce vomiting, nausea, vomiting is an important side effect here. In medulla, another problem. In medulla, if you remember the physiology in medulla, we having center for heart, CVS system. In medulla, we having center for respi. Okay, respiratory center and cardiac center present in medulla. Respiratory center and cardiac center present in respiratory center and cardiac center present in medulla. So what happen if in case of very high drug abuse for this drug, CVS system suppress, respiratory system suppress. Understand what happened with CVS system, what happened with respiratory system, because these center present inside the medulla. So in spinal cord, they inhibit the pain stimulus, the pain suppression, pain suppression. So our main thing happen inside is that this drug working in midbrain, pain suppression in midbrain, pain suppression in spinal cord. Okay, pain suppression in spinal cord. The remaining thing here, they're producing side effect like euphoria. One, clear? They're producing side effect like euphoria. They're producing side effect here, meiosis. They're producing side effect here, vomiting. They're producing side effect here, CVS and respiratory depression. Okay, so they're producing side effect here. Now move to hollow organ system. Hollow organ system. In the mast cell, okay, come here. In the mast cell, listen here carefully. In the mast cell, if you remember mast cell doing what? Mast cell, they release histamine.
Some.
Mast cell, they release histamine, okay? So if this histamine release inside the respiratory system, what happened? Respiratory system, histamine release is causing bronchoconstriction. Broncho, if you remember anaphylaxis, yeah? So they release histamine. So they release histamine. If any person having asthma, must keep in mind, and having road traffic accident and you giving opioid to pain control because have fractured bone, yeah, very severe pain, you have to give opioid. You must care about asthma also because they release histamine. These drug release histamine is not good for asthma patient, you know, yeah. Histamine causing bronchoconstriction is not good for asthma patient. So they're releasing histamine. Must keep in mind this effect. They're releasing histamine. Okay. If any person have allergic history, drug allergy, like they have a history of drug allergy release histamine. So this drug also release histamine. Okay. It's not good for any for allergic patient. It's not good for asthma patient. Okay. They're causing histamine release. Okay, now next thing, the smooth muscle. Smooth muscle, longitudinal smooth muscle relax and circular smooth muscle contract. In GID, what happens? Stop every function. Yeah, constipation, urinary retention. Constipation and urinary retention. Clear? Constipation and urinary retention. So, because they relax the smooth muscle, if any patient come to you with very severe abdominal pain, patient have abdominal colic, abdominal colic. Okay, this colicky abdominal pain, if this patient has this colic due to renal, this colic due to gallbladder, Okay, colic due to gallbladder, renal colic, and gallbladder cholecystitis patient. Gallbladder, renal colic, and gallbladder colic, colicky pain there. So you can use these drugs to suppress this pain, okay? To suppress this pain. But some books they write about this gallbladder for gallbladder. If you give in case of like for example, if gallbladder have stone here, okay? If gallbladder have stone inside, okay? So when you give sphincter block, sphincter contract, yeah. So this gallbladder colicky pain here, so gallbladder bile accumulate gallbladder distended, this gallbladder can rupture because this sphincter closed. If the patient have stone, okay, if just patient have cholecystitis without stone, if gallbladder pain without stone, then you can use for gallbladder colic. But if the patient have gallbladder stone, then must be contraindicated. Understand? At that time, you must contraindicate. So because these drugs relax the smooth muscle also. So if any patient have abdominal colic, GAT, this pain because of spasm of smooth muscle in intestine. Sometimes patient have very severe abdominal pain from intestine. Yeah, so you can use this drug. This drug will effective. Okay, to reduce the abdominal pain also. Understand? Must take care about gallbladder. Gallbladder must not having stone. If gallbladder have stone, in that case, so gallbladder can be ruptured. So one contraindication you already explained because of histamine release asthma. Must take care about asthma patient. Understand? Must take care about asthma patient. One contraindication. At what condition you no need to use these drugs? Number one, you must avoid in asthma. Done. Second, you must avoid in case of stone in gallbladder. Okay. You must avoid third scenario, because these drugs they release histamine if any patient come with head trauma. Any trauma, if patient like having road traffic accident, fracture of femur, fracture of humerus, any bone broken, yeah. But if the person head is intact, no head injury, must make sure patient not have head injury. If you giving like more patient have very severe pain, yeah, after having like road traffic accident, patient also have head trauma. Before giving morphine or heroin, before giving these medication to patient having traffic accident, must make sure that patient not have any injury in head. Must make sure, okay? Otherwise you are killing the patient. How I explain now. Head injury is a big contraindication. Head injury. We use this in road traffic accident. Any patient having RTA, okay, like have fracture of bone, fracture of long bones of upper limb, lower limb, any bone fracture. The fractured bone, you know the patient feeling very severe pain. Yeah, so at that time we have to use morphine because very strong painkiller. Yeah, we must give the relief to patient. So, but if the patient have head injury, at that time must take care. Why? Because in head injury, inside the head, the skull, the inside the head, we having like the brain inside. Okay, so the brain inside. So what happen inside? Inside release of histamine, inside release of histamine, they're doing what? So they're causing histamine, causing vasodilation. Already had injury there, okay? Had injury, already inflammation there. If you remember, intracranial pressure will be up, intracranial pressure will be high. Okay, so if you're using morphine in that same patient, the histamine release causing further increase in ICP. This patient died due to herniation of brain. So must take care, keep in mind this sentence. Okay, if patient come to you having bone fracture, okay, any bone fracture, having accident history, okay, so first you must exclude patient not having brain injury, patient not having any head injury. If have any type of head injury, then you must avoid. If you still want to use, Then you must control this ICP. Use another very strong diuretics, mannitol. Mannitol we use in ICP high patient. Okay, so at that time you must take care about ICP. Otherwise, you are killing the patient, not relieving the pain. Understand? So this is very important contraindication. So we use in road traffic accident, but we can use. But head injury is a big contraindication. Head injury. Understand? Not used in asthma, not used in gallbladder stone, not used in head injury case. Okay. Number fourth contraindication in case of pregnancy, labor pain, very severe pain. You want to reduce pain, labor pain. If you give morphine, just now I explained, smooth muscle relax. Smooth muscle relax. Yeah, long smooth muscle relax. So what happened with uterus? Uterus smooth muscle relax. Can they contract? No. Can baby come out? Of course not. What happened with pregnancy? If like the mother now going to deliver the baby, the labor delayed. Now baby can have some problem now. Understand? Baby can have aspiration of amniotic fluid. Baby can have asphyxia inside. So because the labor duration become very longer and longer and longer and longer, mother not have much effort because uterus is under relax. Understand? Uterus under relaxation of smooth muscles, so uterus not able to contract strongly. Oxytocin help contraction of uterus in during labor time. Yeah, oxytocin hormone. So these drug doing what? So if the pregnant lady is using heroin and morphine as a drug of abuse, it's not good for her. Clear? It's not good in case of pregnancy. So in pregnancy, the pain, labor pain. For labor pain, can we use opioid? Yes, we can use opioid, but the problem is that the labor become much delayed. Okay, so at that time it must be contraindicated. We need to use other painkiller, not go for opioid. Understand? So these are very important contraindications. Clear? Very important contraindications: asthma, gallbladder stone, road traffic accident, especially head injury. Okay, especially head injury. In case of head injury, you must avoid. In case of pregnancy, must take care. In case of pregnancy, clear. In case of pregnancy, if the mother using heroin, morphine as drug of abuse, what happened in the new baby? What happened in new baby? New baby also need heroin, morphine when come in world. Try to understand here. Morphine and heroin. Okay, these are drug of abuse. So this enter to fetus. So now the fetal brain, they feeling, the baby feeling euphoria inside. So if now baby come in world, the baby also addicted. If you not give, baby crave for heroin, morphine. You understand this? Yeah. Clear? So the baby having withdrawal effect because inside the, because mother was using heroin morphine at the time of pregnancy. So what happened inside the baby? Inside the baby, when baby come up in the uterus, the baby still receiving heroin morphine. Yeah. So when after delivery, what happened? Mother is addicted. Mother addicted of heroin and morphine. But now after delivery, baby have any supply? No, because now baby baby is out now. Understand? After delivery, now baby also addicted now because 9 months this heroin morphine enter in brain of the baby. Yeah, so now you can understand what happened inside the brain of the baby. Brain of baby also now addicted. What happened in the baby? In the baby, withdrawal effect. Withdrawals effect. Okay, like you withdraw heroin and morphine from the baby, baby also addicted. Clear? It's not good for baby too. Okay, this happen in case of pregnancy. Okay, in case of pregnancy. Okay, now come to our real point. So these side general effect on body, you understand? They're producing euphoria. They're producing pinpoint pupil because of midbrain, third nerve stimulation. Okay. They're producing nausea, vomiting. This is a very important side effect. They're producing CVS and respiratory system depression. Okay. So in spinal cord, the pain suppressing action is also beneficial action. In the mast cell, they're releasing histamine. They release histamine. Okay. In smooth muscle, hollow organ, urinary system, and GIT system affected constipation and urinary retention. Constipation and urinary retention. Okay, now we come to our main point. What are the group of drugs? Strong agonist. Strong agonist. So strong agonist, the first one, morphine. Second one, not mixed with apomorphine. Okay, apomorphine is belongs to Parkinson disease. It's not a morphine. Okay, it's not a morphine. Apomorphine, if you remember apomorphine. Apomorphine is not a morphine. Apomorphine, dopamine receptor agonist used in Parkinson disease. Apomorphine, rotigotine, pramipixole, bromocaptine, caprolactone, all were dopamine receptor agonists. Okay. Non-ergot dopamine receptor agonist apomorphine. I said not mix this apomorphine. So this apomorphine is not a opioid. Okay, it's just a totally different salt. Understand? Non-ergot dopamine receptor agonist. So this is a real morphine. So why this morphine known as morphine? Because these drugs mostly derived from plant, natural. Okay, morphine, heroin, and codeine. Morphine, heroin, and codeine. Okay, morphine, heroin, codeine. These are the full agonists, very strong agonists, full strong agonists. Meperidine and methadone. Okay, now heroin is not used as drug. Okay, so what is heroin? What is the difference between heroin and morphine? This morphine is come from plant name opium poppy. Is a plant. Okay, opium poppy. Opium poppy is a plant, flower of plant. The flower of this plant is then changed to morphine. Okay, so what is the difference between morphine and heroin? Heroin is a full pure. Understand? Heroin is a pure form of opioid. Heroin very strong. Heroin is very strong, white color. Okay. After acetylation, acetylation of morphine, this morphine changed to heroin. Understand? This morphine we can use as drug. Okay, as medicine, but heroin is not. It's not a medicine. Okay, it's just abusing drug of abuse. It's just a drug of abuse. So heroin is not used in medical field. Understand? So this we not use for the person. Okay, understand? This we not able to use in our medical field. So we're using morphine as medicine. Okay, we're using codeine. Oh, one important effect left here. Coming again in medulla oblongata, very another beneficial effect. In medulla, producing vomiting. One in another medulla effect, respi and CVS system depress. Okay, and another important effect. If you remember the cuff center, vomiting center also in medulla, cuff center for cuff reflex. Okay, cuff center, cuff for cuff center also in medulla. So these drugs they suppress or depress the cuff center. So it's mean they also work like working against this cuff. So if any drug working against this cough is known as antitussive. Antitussive. Antitussive mean against cough. Antiemetic mean against vomiting. Okay. So antitussive. So these drugs also working against cough. Okay, now come back here. This clear? So in medulla we having three effects there. One vomiting, another suppress cough, cough center, another respiratory and severe system also suppress. Okay. So this codeine we use in cough syrup. Now you can understand why the person they abusing cough syrup. They just drinking cough syrup because cough syrup they having opioid. Okay, they can't get directly here and here. Of course, it's very hard to get. So very easily the on medical store the cough syrup are available. Yeah, so the person using cough syrup as abusing codeine plus another salt present in cough syrup. If you have any cough syrup, you must read the chemistry of the cough syrup, the composition. You can find out codeine also, and you also can find out dextromethorphan. Dextromethorphan. This dextromethorphan also opioid. Dextromethorphan. Dextromethorphan is also an opioid present in cough syrup. Okay, in cough syrup. Understand? Present in cough syrup. So dextromethorphan and codeine. Codeine we're using as antitussive. It's not used for pain purpose. Okay, it's not used for pain purpose. We just for we use in syrup, cough syrup to suppress the cough. Understand? Okay, what are the uses of morphine? Morphine is very strong painkiller. Very strong. Very strong analgesic. What time we use morphine? What time? Patient come to you with MI. Patient come to you with unstable angina. Patient come to you with bone tumor, bone pain. Patient come to you with fracture of bone. Okay, very severe pain. It's very strong. Okay, morphine is a gold standard in MI. Morphine is a gold standard in MI. Why? Morphine also helps to reduce pulmonary edema developed by left side heart failure. Morphine also helps to reduce pulmonary edema. Okay, two benefit of morphine in MI patient. Morphine also help to reduce morphine doing what? Morphine and extra benefit in MI patient. You know, if you know the MI patient, what happened in MI patient? Which side of heart is affected? Left side of heart affected. Yeah, left ventricle fail mostly. Yeah, heart attack of left side fail. If left side fail, the pulmonary vein come from lungs. If left side fail, then blood stay in lungs. So what happen inside the lung? Pulmonary. Understand? So the morphine, one thing, the pain. We in the heart attack patient, when you have pain stimulus, what happened with your heart rate? For example, you have just like you was playing and just fall down and you're having pain. So what happened with your heart rate? Increase or decrease? Increase. Yeah, because you in pain now. Pain, what the pain doing? Pain stimulate sympathetic system. Understand? Pain stimulate sympathetic system. What happened with the in the pain patient? Heart rate high, blood pressure high. Now you guys tell me these things are good in MI. Understand? So why you not giving NSA to MI patient? Why you not giving other neuropathic like the painkiller in MI patient? We need here very strong painkiller because strong the MI pain, heart attack pain, very severe pain. Yeah, that pain stimulates sympathetic system. So what happened with the heart? Heart already dead. Heart already damaged, yeah, because no blood supply there. So if heart already dead, already injured, if you stimulate sympathetic system, that's good for heart? Of course not. Understand? So this is the reason why you using this morphine. Morphine is the best for MI patient. Morphine is best for heart attack patient. Why we not go for simple painkiller? The simple pain do not suppress your pain very soon. Give morphine, full analgesic system, fully stimulated, no more pain signal inside the brain. Yeah, to suppress the pain, fully suppress the pain. Understand? So morphine is a gold standard drug to suppress the pain in MI patient. And extra benefit, why you prefer, why you not going other, like for example we having